first question to you is, how does the body typically contract hepatitis, and are some types easily preventable than others?
Yes. What is hepatitis actually? First, we should know about it. So, any infection which happens to the liver is hepatitis. So, among these liver infections, there are five main viruses: A, B, C, D, and E. So, we will not be discussing hepatitis D because HDV, hepatitis D virus, usually doesn't occur in India. That is one. Second, it doesn't occur independently. So, we are leaving D. So, we will be discussing hepatitis A, B, C, and E. So, how we get A and E? A and we get through water, food, or infective feeding materials. Okay, if we get infected water ingestion or we drink infected water, suppose the food we eat is infected. So this is how hepatitis A and E spread. But hepatitis B and C spread not with the food but with the we call it parenteral transmission, means through the blood or body fluids like infected syringes, cuts during surgery, blood transfusion, or sometimes from mother to children during birth.
You is, why do some people clear a hepatitis infection completely while others go on to develop a chronic condition?
These A and E viruses usually clears off very easily. So these are self-limiting viruses. So the disease which is caused by hepatitis A and E doesn't last long. Once the patient gets hepatitis B or C infection, it persists for years, which can be throughout the life. So among these four, hepatitis A and B are preventable by vaccines. To prevent hepatitis A, B, C, and E all, we have to take precautions like hygienic food and to prevent infection by contamination syringes and all these things.
What blood tests or markers do doctors look at to assess how active or advanced the hepatitis infection?
It is suggested by symptoms. There are few symptoms like lethargy, mild fever, nausea, vomiting, not feeling like eating, sometimes abdominal discomfort also. So we may suspect hepatitis. So to diagnose hepatitis, first thing we get liver function test. These are some blood tests which shows the liver enzymes are very high, which may show increased bilirubin level also. So we diagnose hepatitis. Then we diagnose which hepatitis is this. There are specific tests for hepatitis A, B, C, and E. These are separate tests. So we ask for these tests.
Is there a connection between hepatitis and other conditions like diabetes or kidney diseases?
There's no direct connection between hepatitis and other diseases. Like if somebody is having diabetes, hypertension, heart patient, kidney patient, so it's not that this patient will get hepatitis. But if the patient with diabetes or say heart disease or kidney disease get the viruses infection, hepatitis virus infection, then these virus can cause severe infection in these patients because these patients are already in a low immune state.
Thank you so much, doctor. So my next question to you is, what is the typical duration of treatment for hepatitis and does it vary significantly between patients?
A or E, we need a proper counseling of the patient. So patient has to be counseled that it is a short lasting disease. Patient should monitor some symptoms and we monitor by blood test also. We give good healthy diet. For hepatitis B and C, it's a little difficult. It varies person to person depending on how much the virus is there, whether virus is active or not, it is multiplying or not, how much damage there is occurring in the liver. So the treatment for A and E is short. For B and C, it depends. It may be short and it may be long, and that depends on the patient and viral load.
Thank you so much, doctor. So my next question to you is, how do doctors counsel patients who feel stigmatized or anxious after a hepatitis diagnosis?
If the patient comes to us with diagnosis of hepatitis, first of all, we have to diagnose which hepatitis is this. Then we check how much the liver damage is going on. If patient get hepatitis B, no need for vaccination, but yes, we counsel the patient of hepatitis B and C to get family screening.
Thank you so much, doctor. So my last question to you is, looking ahead, are there any upcoming advancements in hepatitis diagnosis or treatment that gives optimism for patients?
For hepatitis A and E, as I said, there are no much doubt about the treatment. So we just need supportive treatment. Sometimes there is liver failure in hepatitis A, especially in maybe in 1 to 2% patients. For E, which is now as rare, but it can be serious in pregnant ladies. So for pregnancy patients, if there is hepatitis E, it can be serious. So there is hepatitis E vaccine also available nowadays. There are very good medicines recently available for hepatitis C. which give wonderful response to hepatitis C, and within 2-3 weeks, hepatitis virus become negative. The treatment is continued for 3 months usually. Sometimes we may require for 6 months also.